Hi everyone, Dr. A is here, and today we will talk about fibroids of the uterus or uterine fibroids. And to be more academically, it's called myomas or leiomyomas. When you hear word myomas or fibroid or leiomyomas, they all refer to one thing, which is the mostly benign tumor of the uterus. Fibroids usually multiple and usually benign, and they can be in different size and shape. Fibroids can grow in the uterus, and there are three types of fibroid. One is on the outer surface of the uterus, and the second one grows within the wall of the uterus. The third type is usually comes from the wall of the uterus and they grow into the cavity of the uterus. And these three types of fibroid are very common. Now, the patient can have one or two or the three types together, which is not going to change or may affect the plan of treatment. Now, fibroids grow with women hormone. They usually grow with estrogen, and estrogen helps the fibroid to grow. They grow during the young age until the patient reaches the age of menopause, and after that, due to the relative decrease of the estrogen level, fibroids start to shrink in size. Now, fibroids can cause one or many symptoms. It depends on the location, it depends on the size, and most common symptom is heavy periods. Usually, this patient complains about heavy period or periods that last more than 10 days. These patients usually anemic and they are taking iron, or they are anemic but they are not on any iron therapy. The second symptom is the pressure effect. It depends on the location of the fibroids. Patients usually complain of the pressure. So if the fibroids grow in the outer surface or in the front of the uterus and is pressing on the bladder, usually this patient comes and she usually complains of frequency of urination, or they usually go to the bathroom more than usual. And if the fibroids is in the back of the uterus, usually the fibroids will press on the colon, and usually this patient comes complains of constipation or difficulty of defecation. Also, due to the pressure effect, these patients can complain of back pain or leg pain or heaviness in the pelvis. To diagnose fibroids, usually patients come and they have one or more of these symptoms, and these symptoms usually suggesting fibroid uterus or uterine fibroids. And the second thing is usually due to the pelvic during the pelvic exam. When you examine the patient, you start feeling the fibroids in the uterus, you feel the uterus is enlarged, and you can tell if the patient has one or multiple fibroids, they are small or large. The second thing is very commonly used is the pelvic and transvaginal ultrasound. And usually the pelvic and transvaginal ultrasound is more than enough to diagnose ultrasound, to diagnose fibroids, to find out how many fibroids, how big, the location, and based on these findings, you decide about the treatment plan. That's basically enough for this video, and the next video will be talking about how to treat uterine fibroids. Thank you so much. See you soon.